Have you ever checked your pulse on your smartphone? Have you ever checked your blood pressure on your smartwatch? Or have you ever checked your oxygen saturation on your smartphone or smartwatches? Have you ever asked a question regarding your health to your smartphone? If yes, this is a video for you. I am Dr. Mehta, a consultant physician, diabetologist, and a critical care specialist, and you are watching DoctorPlus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Every one of us holds a smartphone, and it is always easiest to ask questions to someone or to something which is always ready to answer, especially when the question is related to your health, and it is always tough to ask such questions to someone around you, and getting an answer is difficult from spaces around you. But let me remind you, questions on health always changes from person to person, and the answer always changes from question to question. So the worst you can do is asking a question to your smartphone which is logicless, emotionless, and highly unintelligent. And still worse is thinking that the readings of blood pressure, pulse, and oxygen saturation that are shown on your smart gadgets are reliable. So what is the science of smart gadgets and how a doctor deals with these parameters and how a doctor is different from your smartphones? Let's get into the details. First things first, the major difference between a smart gadget that claims to be a health gadget and a doctor is that the health gadgets or smartphones doesn't come with a filter. And by filter, I mean filter of speech or filter of information. You can ask your smartphone that you have a headache, and your smartphone will tell you you have a brain tumor. Your doctor would not say this. You have been running for 15 minutes and now your pulse is soaring high. Your smart gadget will instantly tell you that you have a worrisome pulse and blood pressure, but your doctor will not say this. Instead, he'll be instructing you to take at least 20 minutes of rest before getting a reading of pulse or blood pressure. You are taking a deep sleep and your pulse drops down to 50 or 55 beats per minute, and your smartphone alarms you with a signal that your pulse is dropping. You go back to that smartphone itself and search on the net that why is my pulse getting slower? And that device tells you that you have a congenital heart disease or an impending heart attack. Your doctor will never say this because it is not at all important to measure your pulse and blood pressure while you are asleep. In fact, your blood pressure or your pulse may fall down to 50 or 55 beats per minute when you are fast asleep, and that is completely normal. I always tell my patients to never measure their vital readings, that means pulse, blood pressure, or oxygen saturation readings, in absence of their doctor, because getting an out of range reading will only create a panic and anxiety. However, such abnormal readings of pulse, blood pressure, or oxygen, and even temperatures, when taken in presence of your doctor, is accompanied by valid reasons and logic, along with a solution to those abnormal readings. So make a wise choice. Would you like to have an abnormal reading with panic and anxiety, or do you need to have an abnormal reading with valid reasons and logic? Also, you get a solution for that. I had one of my patients who had a persistent high-grade fever. That patient was given medicines for 2 days, but following those 2 days, he again presented with the same complaint and a same range of temperature, which was 102 degree Fahrenheit. Now, I was surprised to see that he was given antipyretic medications, that is paracetamol, for 2 days at a stretch in higher doses, and still his temperatures were not falling down. To my surprise, when I saw his thermometer, I came to know that the readings were fixed on 102 degree Fahrenheit. Now, the patient was only dependent on those readings. So just imagine such a minor tech glitch can create such a big fuss and the patient might land up in overdosing themselves and creating a mishap. Such medicines should never be taken without the prescription of your doctor. In my routine clinical practice also, I always stress upon the overuse of such smart gadgets, smartphones and health gadgets, that it should never be overused, and over monitoring of your vitals is not advisable. And the reason being, once you get an abnormal reading from such smart gadgets, and if you don't have your doctor around, you'll be always going to your near and dear friend, that is your smartphone, and searching it out on Google. And that friend is your smartphone, which has a fixed answer that either you have a tumor or you have a heart attack, lands a patient into a major depression or shock, and sometimes these patients end up having panic attacks. Because as I said, your smartphone is emotionless, logicless, and highly unintelligent to deal with such cases. And why I say this is because as doctors, even when we declare a patient to have cancer or terminal illnesses, we usually talk to their relatives first, and that is a way to deal with such patients. But your smartphone doesn't care about all these things, because it has not dealt with the impact of death, the emotional burden it creates on the family members, and the fear it creates in the eyes of the patient who is going to die soon. But your doctor has gone through all this. In fact, they are trained and educated to handle such situations for more than a decade before they come into a practice. So, whom would you rely on? Make a wise choice. This is Dr. Jai Mehta, a consultant physician, diabetologist, and a critical care specialist, signing off for today from DoctorPlus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.